Okay, good afternoon, everybody. Welcome to today's webinar. The topic that we're speaking about today and the title of the event is Take Control of Your Vision Health. And today we are going to be joined by Dr. Sima Mozdbar. So before we get started, I do want to do some housekeeping. If this is your first time joining us, welcome. If you're not new here, then welcome back. I'm sure that everybody's very comfortable with Zoom, but if you don't know, there is a chat function on here. So down on the bottom bar, if you click chat, it'll pop up on the right side of your screen. Feel free to write questions or comments in the chat as they arise throughout today's discussion. There will be time for a Q&A at the end, so we will answer those questions at the end of the discussion. Other than that, like I said, if you're new here, if you're not new here, that's okay. We record each session. So if you miss something, if you're trying to take notes quickly, don't worry, it's recorded. It'll be sent out to you in a follow-up email, and it'll also be posted to our Speakers Bureau site. So without further ado, I want to welcome Dr. Sima Mozdbar. She is an optometrist and an assistant professor in the Graduate School of Biomedical Sciences. So thanks so much for being here today.
Thanks for having me.
We're really excited to learn about eye health. It's important to all of us. We all have eyes. So without further ado, can you share a bit about your background and training?
Yeah, so from a young age, I've always been fascinated by how the human body works, and I knew I wanted to get into healthcare. So I attended the University of Texas at Austin for undergrad, hook 'em horns, and I earned a Bachelor of Science in Public Health there. And during that time, I had the opportunity to shadow many different specialties within healthcare, and I really enjoyed my experiences with local optometrists. The connection between eye health and systemic health is what really interested me in the field of optometry, as well as being able to improve quality of life by helping people see better and through prescribing glasses and contacts, or whether through detecting disease and managing that as well. So then when I finished undergrad, I went on to complete another 4 years at the University of Houston College of Optometry, where I earned my Doctor of Optometry degree. And there I completed clinical externships in ocular disease and specialty contact lenses. I did one rotation at Baylor College of Medicine in Houston, and then I did an ocular disease rotation in Dallas at a community clinic. And then in 2018, I joined UNT HSC as a faculty member, and I was provided with support to build and direct the Ophthalmic Clinical Research Center, which is UNT HSC's first medical eye care clinic, as well as home to our research projects. So I've really enjoyed the opportunity to serve as an integral part of the interdisciplinary team here to take care of the patient as a whole.
That's great. And we're happy here at the Health Science Center at Fort Worth to have you. So thanks so much for sharing that. So let's dive into the topic of today. Let's talk about eye health. So my first question is, when should someone start getting those eye exams? Should it be based upon when we have a noticeable decline in our vision, or should we start from a younger age?
Right, so how often you need to get exam really depends on your age, your eyes, your medical and family history, and the best person to answer this question for you is your eye doctor. But in general, it is recommended for children to have their first eye exam at 6 months of age, and then once more between 2 and 5 years of age, and then again right before entering school and every year after while they're in school. A lot can change with a kid's vision over the course of a year, which is why it's really important for them to get their annual eye exams during their time in school. Then adults 18 and up should have eye exams every 1 to 2 years, and then over the age of 60 should go back to having an annual eye exam. And to answer the other part of that question, it's important to get an eye exam, even if you feel like you have good vision and you don't need glasses or contacts, because for children, they might not know what normal vision is, and so they might not complain of vision problems. And comprehensive eye exams can allow us to detect any vision issues, especially ones that could lead to amblyopia or lazy eye. And that is due to an incomplete development of the visual system. And unfortunately, if it's not treated early enough, it can lead to permanent vision loss. And then as we age, we're at an increased risk for age-related eye diseases. Often these don't have any early warning signs or symptoms. So again, it's really important to get your comprehensive eye exams, and we can detect and treat these early and hopefully prevent vision loss or blindness.
That's great. So going back to the kids for a second, they might not know or understand what perfect vision looks like. Are there signs or symptoms as a parent or a caretaker that you might be able to say you might be having some eye issues? Could there be like headaches or anything else like that they should look out for?
Yeah, that's a great question. So things to look out for in kids, of course, this isn't a comprehensive list, but rubbing of the eyes is actually, while they're doing tasks, and squinting, blinking a lot, those can be signs of a lazy eye. Watching for an eye turn is important. If they're sitting super close to the TV or video games, or if they need to bring their reading materials very close to their eyes, they might have a refractive error that needs to be corrected. And then, yeah, so those would be, I think, the biggest things to look out for. But yeah, with kids, mostly just trouble with doing homework and things like that, visual tasks.
That makes sense. Thank you. So once we start going to those annual or biannual exams, what is an optometrist looking for during that exam?
So in addition to taking measurements for evaluating your vision, and we look at how well your eyes are working together, we also are evaluating the health of all of the structures in your eye, and we look for the presence of any changes due to disease. So it's actually really interesting that the eye is the only part of the body where we can non-invasively visualize live tissue. So not only can we diagnose eye diseases, but we can actually detect over 250 systemic conditions from an eye exam. And this can be from neurologic disorders, aneurysms, complications from diabetes, high blood pressure, high cholesterol, and even cancer. Actually, last year, 250,000 people found out for the first time that they were diabetic through an eye exam. And this also kind of ties into my research, where we're looking at the retina for early biomarkers for Alzheimer's disease. And researchers have found that changes in the retinal layers of patients with early Alzheimer's disease are happening, and we're able to visualize this non-invasive tissue. So the retina really does have potential to be an early biomarker, a widely accessible screening tool as part of the diagnostic process for Alzheimer's disease.
Great, thank you. So while you're in that exam and you're looking for all of these different things, there is a lot of technology being used. So can you explain some of the different pieces of technology that are typically used during an exam and how the technology has changed in the industry?
Yeah, so there have been some advances made in the traditional portion of an eye exam that have made the exam easier. For example, now we have an autorefractor. If you're familiar with looking in the device, and it's the house on the hill or a hot air balloon, typically is what you see. And so that gives us an estimate of your prescription. And so that's a great starting point for determining if you need glasses or contacts. We've also now have digitalized eye charts and phoropters. That's the device that goes over your eyes, and we ask which is better, one or two. So those are some changes that have been made. Also, eye pressure is easier to measure now. In our clinic, we have a lightweight probe that just taps the eye. You barely feel it, and there's no more puff of air. And that takes a lot of the anxiety out of an eye exam, because I know almost everything I do, people ask, okay, is this the puff of air? I'm like, no, we don't have that. And then also fundus cameras. So we can take wide field images of the retina now without the patient being dilated. We're able to take those pictures, and it gives us, it's a great patient education tool, and it gives us a nice way to document pathology. Of course, all of our patients are dilated in our clinic, but it is just a great way to show patients things that are going on and have a baseline for their future visits to compare to. But I want to say that the biggest leap in technology, I think, has been in the diagnosis and management of ocular disease. So we now have the ability to catch these problems before they become vision threatening, and we're better equipped to manage disease progression. So just like think about your cell phone camera and how the camera was on your first phone versus how it is on your phone now. So we have this amazing ability to look at the structures of the eye in high resolution and measure individual retinal layers. And we can even measure individual movement of red blood cells, which is pretty fascinating. For reference, the retina is 5 sheets of paper thick. So it's very, very thin. And so because we're able to see this tissue in such detail, we can actually monitor changes more closely and detect disease very early, and also get patients to surgery or treatment earlier. And so we can help preserve their vision longer.
Well, that's great. You know, technology keeps evolving, and as a layperson, I can say that I'm really glad to hear that the puff of air is gone. You can be so prepared for it, and it still shocks you.
Yes.
But I'm glad. That's amazing to hear. So what are some common conditions that you're finding during these exams and that you look for, and how are these conditions treated? I'm sure there's a laundry list, but what are the most prevalent?
Yeah, so lots of different conditions we're looking for. So obviously we look for refractive error, and that's an important part of the evaluation. But in addition to just getting you to see well, we want to keep you seeing well. And so that's through looking at the health of your eye and managing any disease that's present. So most of the patients in our clinic here are referrals through the other UNT HSC clinics. So we manage a lot of complications from diabetes, high blood pressure, and cholesterol, and those can all be sight-threatening if not managed. So just to kind of talk about some of the most common age-related conditions that we see, cataracts are very common. And this is a clouding of the lens inside of the eye. It's a normal age-related process. It will happen to all of us if we live long enough. And some people are at risk of developing cataracts sooner than others. And this can include if you have diabetes or have a history of steroid use. And with cataracts, as they develop, you'll have blurry, cloudy vision, and you'll have issues with glare and contrast. Earlier in the stages, we can get some of the symptoms improved with glasses and also anti-glare lenses. But then once the disease progresses, cataract surgery is really the only effective treatment to get you to see clearly. Diabetic retinopathy is the leading cause of visual impairment and blindness in working age Americans, unfortunately. So diabetes can affect your eyes in many ways, but the elevated blood sugar damages the vessels in the retina. And so they can break down, leak, or become blocked. And so it's really important for patients with diabetes to at least get an annual eye exam so we can evaluate for these complications. Once there's abnormal bleeding or growth of abnormal blood vessels, then treatment options include laser surgery or injections into the eye. Another common condition is glaucoma, and glaucoma is a group of eye diseases that damage the optic nerve in the eye. And the optic nerve is the cable that connects our eye to our brain so we can see. And so glaucoma is also called the silent thief of vision, and there are no early symptoms. So once it starts to affect your vision, the disease is actually progressed pretty late in the disease process. And so again, why it's so important to just get your annual exam to get these things checked out. The treatment for glaucoma is typically medicated eye drops, but there are laser surgery and other surgery options as well. And then macular degeneration is also very common. This is a condition that destroys the macula, and that is the part of our eye that's responsible for our central vision, so making out fine details. Treatment early on is monitoring, quitting smoking if you're a smoker. We can also recommend diet and supplement modifications, as well as UV protection to help slow the progression. And then the last one, dry eye, is so common. I see this at least every day. And the underlying inflammation process that's happening is actually contributing to dry eye on the ocular surface. And so there are many different causes of dry eye, but we want to treat that inflammation. And so treatment will really vary on how severe your dry eye is, but it can start from artificial tears and warm compresses and end at steroids, specialty contact lenses, amniotic membranes on the front surface of the eye, and so much more.
Well,
So
it really seems, yeah,
yeah.
no, but that's a great way to describe that. I mean, the eyes are really the window to what is going on the inside. So you can tell so much from just looking at the eye. So thank you for sharing all of those. So we talked earlier about some early symptoms that you could see in children when looking for maybe some vision difficulties, but what about in adults? What kind of symptoms should we be on the lookout for to see our optometrist sooner than our annual visit?
Yeah, so I think most people have a pretty good idea of what their vision, their normal vision is on a normal day. And so really anything outside of that normal for you, any changes in your vision or any new symptoms like redness or itching should warrant a visit to your eye doctor. In particular, some instances like if you think you have an eye infection or if you've had an eye injury, you should get evaluated to rule out any potentially serious damage. And then some symptoms that are kind of red flag symptoms, you want to get it checked out pretty urgently, would be sudden changes in vision or sudden loss of vision. That needs to be checked out same day. You should get seen. And so even if your vision darkens out for a few seconds and comes back, sometimes that can be an early warning sign of a stroke of the eye or a stroke systemically. New onset of flashes or floaters is another symptom not to ignore. And so that could indicate a retinal detachment. So you want to get that checked out very quickly as well. And then sudden onset of double vision. Sometimes this could be a warning sign of something going on in the brain or nerve damage. So you want to get those things checked out pretty quickly.
Thank you for that. So earlier you mentioned a few times conditions like diabetes and a few other things. So are there certain health conditions that people have that maybe we should be more proactive in regularly seeing our optometrist?
Yeah, so everyone needs to see, I recommend everyone to see an eye doctor every year, but there are certain people who are at risk and should really make sure they're being seen at least annually, and then their eye doctor can make specific recommendations on how often they need to be seen. And so, for example, some of my patients with diabetes can be monitored annually, but others need to be followed every 3 months, and that's just based off the severity of the findings in their eye. A good rule of thumb is if you're taking prescription medication, you probably should be making sure you're getting at least an annual eye exam. And then other at-risk groups are if you have a personal or family history of disease. So if you're already have been told you have disease and you're being followed for it, or if you have a family member with glaucoma, macular degeneration, all those things have a genetic component related to them as well. Certain racial and ethnic groups are at higher risk of conditions. For example, African Americans and Hispanics are at higher risk of glaucoma. So really making sure you're evaluated for that. And then we already talked about this, but if you have any systemic health conditions that can affect the eye, and primary care providers are good at letting their patients know the importance of an eye exam if they in particular have one of these conditions. And if you're taking any medications that can have eye side effects as well, contact lens wearers need to be seen at least every year. And then just if you have any other eye-related concerns like we talked about in the last question.
So it seems like bottom line, get your annual eye exam.
Yes.
That's what I'm hearing.
Yes.
So I have kind of a big question for the year of 2020. Screen time was already an issue of sorts in the years prior, but 2020, we've pretty much all gone virtual. Kids are now doing school virtually. We're working from home. We are on screens basically all day. So how do screens impact our eyes, and what can folks do who have been working from home or looking at smaller screens throughout the day for an increased amount of time? What can we do to take care of our vision?
Oh yeah, so we've definitely transitioned to our new normal, which is a lot of computer time. We don't even have breaks to walk to the next meeting anymore. It's all right here on the computer. And so using our digital devices for such extended periods of time, switching between our tablets, our phones, our computers, the TV, all of this can cause a whole host of problems like eye strain, headaches. It can also cause dry eyes, which can lead to blurry vision. And then of course you can get neck and shoulder pain as well. And so when you use the computer, it actually it requires additional demands from your eyes to contribute to being able to see clearly at that distance. And so that can lead to eye and vision discomfort if you don't take breaks. And so the number one thing to do is take breaks for your eyes. So get up and stretch, go get a glass of water, look out the window. So the 20-20-20 rule, if you haven't heard of it, it's for every 20 minutes of computer use, look into the distance 20 feet away for 20 seconds. And so this is that's an easy way to remember, to just give your eyes a little bit of a break and let them stretch a little bit. Our eyes aren't as flexible as they were when we were younger, and so we need to let them relax and refocus. In addition to that, we already talked about getting an eye exam, but making sure that you have clear vision, so wearing your glasses if you need to. And then there's certain coatings you can put on your glasses like anti-glare, and then now blue light blocking glasses are all the rage, but some of those can help to reduce fatigue associated with computer use. Remembering to blink is also really important. You don't really think about that, but when we're looking at a computer screen or our phone, we're so focused that we can forget to blink as often as we should. And each time we blink, that's lubricating the front surface of our eye and it's keeping our eye moist. And so that contributes to clear vision. So keeping reminders in your head to blink and taking those breaks. And then lastly, I would recommend just good computer and seating posture. So sitting in a way where your computer is a couple inches below eye level, and then putting your computer screen in an area where you can avoid glare. So particularly from natural light from windows or overhead lighting. So.
That's all great information. I feel myself blinking more already because you said it.
Yeah, there's actually an app you can download with blinking exercises. So yeah, who would have known?
Yeah, there's an app for everything, isn't there?
Yes. Yes.
Not to put you on the spot again, but could you go back and say the 20-20-20 rule one more time?
Yeah, sure. So it's for every 20 minutes of computer use, look 20 feet away for 20 seconds. So looking out the window or across the room if your room is big enough.
Yes. Okay, perfect. And then back to the blue light glasses for a second. You said it's all the rage, and I can attest to that. You see it everywhere on social media. You see them in the meetings. I'm guilty of wearing them. But are there certain ones that are better than others, or is any blue light glasses helping a little bit?
That's a really good question. With blue light, the studies have shown that it can affect melatonin release and affect our sleep cycle. So the blue light can help reduce eye strain and fatigue from prolonged use on devices. But some studies have also indicated that it might help with preventing some eye diseases, and there's not enough evidence to support that. And so as far as the blue light goes, I would just make sure that your doctor can recommend an actual filter on your glasses. I know that they just sell over-the-counter blue light glasses, but you want to make sure it's actually blocking the blue light. And if you buy something over the counter, they can actually test it at your eye doctor's office to make sure that it's blocking that blue light. And so wearing those while you're using the computer can help, but it can't hurt is what I tell patients. And so kind of make your own decision there. But just know that the sun actually emits much more blue light than a typical device. So when you're outside, it's really important to wear UVA and UVB blocking sunglasses. And that actually will make a lot more of an impact as far as blocking blue light than when you're on the computer.
Okay, well, that's great information. See, we're learning a lot. I did have a question in the chat just come through. What about amber glasses? Do you know anything about those?
Yeah, so amber glasses are typically recommended for individuals with issues with contrast sensitivity. So whether that's from an eye condition like cataracts that's affecting your contrast, or you have light sensitivity, things like that. And so it blocks short wavelengths, and so it allows you to have improved contrast. So that's typically the use for amber glasses. As far as using them for sunglasses, I would just recommend that you make sure that they block UVA and UVB rays. And then for sunglasses, I recommend polarized glasses as well. Those block more light from getting through as well.
Okay, great. Thank you.
Mm-hmm.
So to kind of wrap up our conversation before we get into the Q&A, my last question for you is, what general steps can we take to be protective of our eye health?
Yeah, so I think I said it after every question, but get your comprehensive eye exam at least once a year. This is really the best thing you can do for your eye health. Even if your eyes feel healthy, even if you think you have awesome vision, we want to check the health of your eyes. So a lot of these conditions, unfortunately, don't have signs and symptoms until later in the disease process. So the earlier we can catch them is the earlier we can treat them and hopefully preserve vision. And then taking care of your overall health is also really important. So that can go a long way in making sure that that your eyes stay healthy. So managing your systemic conditions, doing a good job of taking care of your diabetes, being in control of your high blood pressure, that can reduce the risk of ocular complications from those diseases. Also eating eye healthy foods. These would be like dark leafy green vegetables, yellow vegetables like bell peppers, a high in omega-3 fatty acids, so like salmon and tuna are good as well. Staying active, and then quitting smoking if you're a smoker. And then lastly, just protecting your eyes, wearing sunglasses when you're outside, wearing protective eyewear during tasks that require them, like high contact sports or gardening, working around the house, and then giving your eyes a rest, the 20-20-20 rule. And if you're a contact lens wearer, practicing good contact lens hygiene. So I have seen people go blind from wearing their contacts not as prescribed. So it's really important to clean your contact lenses as your doctor told you. Don't sleep in them if you're not supposed to, and discard of them as you're prescribed as well.
All great information. Thank you so much for that. And it honestly just seems like we all need to be more intentional about taking care of our eyes. It seems like something we kind of forget. So
Yes.
at this time, I am going to do an all call. If you do have questions or comments, feel free to put those in the chat. I do have a few that were submitted prior to the event today. So if you do have questions, get those submitted on the chat on the right side. So one question I have really quickly for you is, some people say, and this is, I'll call it a myth, they say that wearing glasses is a quote unquote scam, because when you start wearing glasses, then your vision, it seems to decrease and you have to re-up your prescription every year. What do you have to say about that?
Yeah, so we see that, I've seen that a lot, and unfortunately, some parents have that mentality too, and don't get their kids the vision correction they need. And so it's really important to explain this concept to patients. So when you wear glasses, your brain adapts to that prescription. And so then when you take them off, your vision's going to be blurry because it's adapted to seeing clearly and crisp single vision with those glasses on. And so if you leave them off long enough, your brain will adapt again to seeing without your glasses or contacts. But especially in kids, it's important to have that clear single vision with your glasses in order to allow that visual system from your eye to the brain to develop properly. Without that, it can lead to conditions like lazy eye. And then that's really in the process where we're growing and developing that the prescription will change. But again, telling patients and parents how important it is for their kids to keep their glasses on. And then as our prescription stabilizes, your vision will not get worse from wearing glasses. Really what's happening is your brain is adapting to that prescription. So when you take it off, it is going to see blurry because it's adapted to clear vision.
Okay, perfect. Thank you for clearing that up. That's an old wives' tale that I'm sure we've all heard. So
Yes.
thank you. So a question that we had submitted before, I'm going to read it to you. It's a little bit long. So it says, could you please describe the additional risk to a patient that has been diagnosed with holes in their cataracts, especially one who is extremely nearsighted? What is the best course of action as those cataracts affect an older person's abilities, such as balance and other everyday activities?
So I think this person may have meant to say holes in the retina because that is associated with being nearsighted. And having retinal holes, so the retina is the tissue that lines the back of the eye. And if you think of it kind of like wallpaper, people who are really nearsighted, their eye is longer than the average eye. And so that wallpaper is stretched thinner. And so they are at an increased risk of holes, tears, or detachments of this tissue or wallpaper. And so the question was additional risks for cataracts. And so So if you go for cataract surgery, it's an intraocular surgery. And so any intraocular surgery poses a risk of a retinal detachment. And so you just might be at higher risk. But that's a discussion you can have with your eye doctor and your eye surgeon. And they might recommend actually treating those holes with a laser that kind of glues that tissue down prior to cataract surgery to reduce that risk. And then the best course of action. So if cataracts are really getting in the way of your daily living tasks, so that's something that you can talk to your doctor about, because that's typically the point where we start talking about surgical intervention, is when it's getting in the way of your daily living tasks. But if your vision's still not so bad, you can tolerate it, and you want to wait on surgery, then updating your glasses is what I would recommend, and using an anti-glare coating on top of your glasses, and then using sunglasses when you're outside too.
Perfect, thank you. Well, I don't have the name in front of me, but to whoever asked that, I hope that was helpful. And what I understood from that is to just have those candid conversations with your eye doctor, because they need to know what's going on so you can talk about next steps.
Mm-hmm.
So I have one other one that was submitted previous to today. It says, my last eye exam a few months ago, I was diagnosed with very early stages of macular degeneration. I was told to begin taking over-the-counter eye vitamins, mineral supplements, Pressor Vision, a couple other things that are listed there, and it would keep from progressing. Do you concur with that statement?
Yeah, so we do recommend supplements for patients with macular degeneration, particularly the intermediate stage is when the eye vitamins have been shown to help delay progression into the more severe form. But some other things you can do is just really making sure that you have a good diet. So leafy green vegetables, yellow vegetables like bell peppers, and I kind of already touched on this, but those are really things that you can do to help make sure you're getting all the nutrients you need to keep your macula healthy. Those supplements contain what's called lutein and zeaxanthin, and those are important components of those supplements that help keep your macula nice and healthy. And so your doctor probably recommended it as more of a preventative and prophylactic treatment option. And so yes, that's a good thing to do. And then make sure to stop smoking if you're smoking, UV protection, and then healthy diet and exercise.
Great, thank you so much.
Mm-hmm.
And then we have two last ones that have come through in the chat. So the first one says, can you speak to youth in sports, specifically athletes who are playing on soccer fields and such, who it is important for them to consider UV exposure to eyes, aside from protecting them from trauma?
Yeah, so with youth and high contact sports and things like that, and outdoor with UV exposure, it's definitely important to consider UV protection for kids as well. Oftentimes we think of UV protection for helping with cataracts and macular degeneration, but kids' eyes are actually very susceptible to harmful UV rays from exposure to the sun. So for sports like that, oftentimes we recommend contacts over glasses, because with glasses you have the possibility of injury and the lens shattering and causing trauma to the eye. But with contacts, there's actually a new one that came out that does have a UV tint. It's like a transition contact. And so when you're exposed to UV outdoors, the contact actually becomes a darkened shade to help prevent from UV protection. And so that is something that came out over the last year. And that's a really great option for like a soccer player, like you mentioned, with outdoor UV exposure and playing sports. It kind of balances both of those.
Yeah, and that's great. Another thing technology's done for us. That's amazing.
Yes.
One other question we have, it says, my eye doctor said I have beginning cataracts and I should wear sunglasses. Is there particular kinds that I should be wearing?
Yeah, so for sunglasses, I just recommend that you make sure it blocks UVA and UVB light rays. And then polarized is just a type of lens that you can also purchase that blocks out more light. And so that can help protect your eyes from even more UV rays. And then making sure that the sunglass, the lens actually covers your eye, and then also the skin around your eyes. So sunglasses are great for protecting your eyes from the sun, but we also want to protect the skin around your eye from the sun because that skin is very susceptible to skin cancers. So making sure you're protecting the eye tissue as well.
Okay, great. Well, do you have any closing statements for us or anything that you want to leave us with?
There's one more question I see right now. I can go ahead and answer that. So someone said, I have an upside down back machine, and when I use it, I can feel the pressure in my eyes increase. Is this something I should avoid using? And so when you go to your eye exam and you get your eye pressure checked, that would be a great time to ask your doctor about this, because this is just a temporary increase in your eye pressure that's happening because when you're upside down, you're getting more pressure in your head buildup, and so that's increasing your eye pressure. But because it's temporary, hopefully you're not doing it for too long, then it shouldn't cause damage to the optic nerve, which is what we worry about with high eye pressure. But again, just make sure your eye pressure is normal on a normal day at your eye doctor's office.
Perfect. Thank you.
Yeah. And no, that is all I had. So thank you for your time and participation, everyone, and hopefully I answered all of your questions. And feel free to reach out with any questions or concerns.
I'm sure you're going to get an influx of appointments after this. We're all concerned about our eye health now. But thank you so much, Dr. Mozdbar, for your time today. This was extremely informational to everybody who's here participating, and even those who have registered and weren't able to make it. Again, it is recorded. We will be sending it out and posting it so you can go back, get all of the information that you need. But other than that, we're going to give you some time back in your day. So thanks so much for being here. And thank you again, Dr. Mozdbar.
Thanks for having me.
Have a great day.
You too.